I had so much anxiety about this when it started. I honestly, it's so complicated, I never thought it would happen. I just thought that at any point things could fall apart, and it hasn't. In fact, it's been really successful.
Interprofessional education is formally defined as trainees or learners from different professions learning with, from, and about one another.
It was important through this experience to understand how we have different trainings and the backgrounds that we come from, because we can all provide something different to the table. From my standpoint, I would talk about their medications and any side effects they were having or what medications didn't work for them in the past. A medical student, they were more focused on the clinical picture. So the diagnosis, maybe relevant labs.
But the key is that you should be learning about what the different professions do and how can you interact so as to maximize the kind of care you can give to patients. It isn't that, oh, well, that's beneath me, you get to do that. It's, you're better at this, I'm going to do this, so that we divide everything up and the patient really feels cared for.
What they really learn is team-based care. You can deliver care in a team, better care, less expensive care, and you feel better about giving the care because you're doing the kind of work that you should be doing at the highest level that you can be doing it.
IPE works best with complex kinds of settings and complex medical and psychosocial problems, and unfortunately HIV remains that. It's a really good population to have multiple perspectives there.
What was more challenging for the doctors wasn't knowing how to treat HIV. It was basically all the barriers these patients have, what we call the social determinants of health that played into the treatment of the patients, and that was really challenging.
What they have is this core belief about the importance of social justice and the determinants of health. And those people with that passion, you can't stop them.
I've always been very connected to working with marginalized or underserved communities. I am coming from a background that is very similar to that. I am the son of parents who have immigrated from a third world country. I can definitely understand the struggles coming from that background, and when you have to decide whether you come in for care or go to work because you have to provide for your family, you're going to provide for your family.
There was this homeless Mexican patient who didn't have any kind of insurance, he didn't have any ID, he didn't have any kind of proof that it was him. So we were trying to figure out the situation, trying to call the embassy in Mexico. I was trying to understand what his situation was in Spanish. We were trying to work with social worker. So it was this very nice interaction, and at the end of the day, he was able to continue with his regular medical care.
Another reason for the success of this program are the clinic mentors that we were lucky enough to find. That's Dr. Jenica Ryu at USC and Dr. Derek Butler at the THE Clinic and Dr. Artis Mo at the Valley Clinic. Those three people have done really all of the teaching in the practicum sites. They're probably the best of the best in Los Angeles, and we have them for this program.
One little tidbit that one of those students learned in my clinic, 10 years from now, they may come across a situation where a decision they make or something they say may change someone's life based on that experience they had. If they hadn't had it, they wouldn't know what to say or how to say it or what to do.
The physicians I work with, most of them I was so inspired by their practice. I feel like their patients were so happy with them and had such a great experience. That really motivated me to be that kind of physician in the future.
Dr. Raul and Dr. Butler, the mentors that we had as doctors, they were very positive and they were very intuitive of what a patient needed. they remind me of nurses. Nurses are very caring, and I'm not trying to be like a stereotype about that, but they took the time out and they really like their patients, and I want to be such a provider like that.
I'm also a person living with HIV, so I'm over 30 years into living with HIV, so I feel so passionate about making sure that when we leave, the people, those of us who had that kind of life experience of our friends and loved ones dying, that when we leave, there's going to be a workforce there that is passionate and caring and can carry the torch. And this project really does give me hope for that.
I guess the major surprise is we had a couple people come out of the program who've declared that they're going to work with HIV as the focus of their professions. So that was unexpected and really exciting.
So I think in 5 years' time, I'll just be finished with my training and I'll be looking for a job in HIV primary care, and that is my goal.
I don't think so. I know I will. I know I will provide services for HIV.
Even if you never go into an HIV, especially working in a clinic, you're going to come across it at some point. It's going to show up, and you may be the expert in the room on it wherever you're working. Think about how powerful that is if you have that, and you be the teacher to everyone else.